Hello, I'm Bill O'Donnell and welcome to another program on spirituality. Today in the studio I have as our guest my dear friend Dr. Wendy Van Dilla, a naturopathic physician here in Santa Fe in northern New Mexico, and it's something I want to do for a long time, so welcome Dr. Wendy.
Thank you, Bill.
Dr. Wendy has been a big help on this program for many years, and I wanted to get her in here to talk a little bit about something that's close to my heart, and that is natural healing, and particularly naturopathic medicine, of which Dr. Wendy is a graduate of what school again?
The National College of Naturopathic Medicine in Portland, Oregon.
Okay. And even the more happier note is that Wendy is a native here of New Mexico, born and raised in Los Alamos, and so she comes from a scientific background as well as an interest in natural healing, so it's great to have you.
Thank you.
Okay.
Glad to be here.
Tell the folks at home who don't know anything about naturopathic medicine what it is and why it's actually so important.
Naturopathic medicine is a traditional Western holistic medicine. It has its roots from Europe several hundred years ago. It came to this country in the late 1800s. And since then it's been modernized to include modern medical sciences. So there are 4 naturopathic medical schools in the United States that teach a residential program that the first 2 years is basically like a medical doctor would go through with the basic medical sciences and diagnostic and clinical sciences. And then where we're really different from the MD world is how we treat diseases. We use natural medicines and diet, nutrition, lifestyle changes, herbs, homeopathy, physiotherapy, hydrotherapy, and we also do a lot of preventative medicine to help keep somebody healthy, as well as optimize their health once they are healthy.
And even the traditional naturopaths typically used to say everything but drugs and surgeries and radiation probably. Is that a fair statement still?
Mm-hmm. Yeah, I think of medicine as being on a spectrum, from home care, self-care, to emergency style medicine, which the MD world excels at. They do very well at urgent care, emergency care, when you've got, an accident or a wartime situation. But there's a lot of in-between medicine, or a lot of in-between area between self-care and emergency care. And the MD world really doesn't do that well with managing chronic diseases, and that's where the holistic world really comes in to bridge the gap between what you can do at home and before you need the hospital type medicine.
Mm-hmm. Well, for longtime viewers of the show may wonder why we're doing something on healthcare. Well, I contend that the body is the temple of the spirit, and we need to become good stewards of our own body and take care of ourselves. It's one of the greatest gifts that God has given us, is to maintain and learn how to maintain our body. And from my experience, I can tell you I don't know of another group of healthcare providers who provide more information, more help in terms of just optimizing your health and recovering from disease than naturopaths. So that's why I wanted you to meet Dr. Wendy. Tell us about yourself and how you got attracted to natural healing.
Okay. I grew up in Los Alamos, so I'm a first generation New Mexican. My parents were both scientifically minded. My father was a biological research physicist. He didn't want to be in the weapons, so he went into health research. My mother was a full-time stay-at-home mom, but she has a background in chemistry. So I came from a very intellectual standard, and they took us to standard medical care. I didn't get interested in natural medicines until I was an adult and had some chronic health problems that the MD-style medicine really had no answers for. And I was living up in Anchorage, Alaska, and there was a health food store up in Anchorage, Alaska that did a lecture series, and one of the speakers was a naturopathic physician, Dr. Carrie Jasper, and I went and heard him. And then I had an odd rash that I didn't know what was causing it, so I had an excuse to go see him as a doctor. And one of the first things he told me was, stop eating white sugar and white flour now what'd you come in here for? So that was my first huge diet change for health reasons. And I started looking at all the different things that white flour and white sugar had, or what things were made from that. And that was a huge dietary change. And that got me interested because it helped. It started helping me with some chronic digestion problems.
So isn't it true that so many healthcare providers that are successful today often were challenged in their own life, and that's what led them to go and study and find out what the truth was?
Yeah, yes, absolutely. And a lot of us, I mean, I had no interest in going into medicine because all I knew was the regular AMA style medicine. But when I realized there was something else out there, that's when I started getting interested in making a career out of this. And it's really more of a calling than a career, because it's a very service-oriented profession. I mean, I spend an incredible amount of time with my patients. I mean, an hour and a half, 2-hour initial interview is normal. And usually in the AMA medical world, the only time you spend that much time with a doctor is when you're unconscious and you're being operated on.
Yeah, we're not here to demean medical doctors, allopathic medicine. My father was one. He was a wonderful man and did great work, but they tended to be a little wrapped up with the pharmaceutical companies primarily, and they were into conventional medicine and that sort of thing. And what we need in our own lives is knowledge and information on how to best take care of ourselves and our family, make sure our kids are raised well, and learn the importance of good diet and health practices, and that's where Dr. Wendy is outstanding in her. I've heard her give a number of talks at Vitamin Cottage and other places where giving out wonderful information for people. Give us an example of naturopathy across the country in your experience.
Naturopathic medicine across the country. We're getting to be more and more popular of a medicine because people are not getting some of their chronic healthcare needs and preventative education from the AMA style world. And I agree with you, Bill, that that's a very important thing to have in our lives. I feel very lucky to have all the modern technology and AMA style medicine, because when you need it, it's great to have a hospital nearby. But there are a lot of conditions that style of medicine does not address. And people are reaching out and interested in taking more responsibility for their health care, and they want somebody that's going to be willing to spend some time with them and explain what's going on and teach them, not just quickly assess it themselves and write a prescription and then on to the next person. So,
okay, let's get into it a little more. Give an example of either the difference between examples of difference in naturopathic medicine, allopathic medicine, or just go in and tell us about the kinds of things that naturopaths treat and or recommend for keeping your health.
The principles that guide naturopathic medicine, I think those are important, because as naturopathic physicians, we all have different interests. It's kind of an umbrella field that includes a number of different modalities. Some people are more physical medicine oriented and do naturopathic manipulation similar to a chiropractor, and they focus more on musculoskeletal problems. Myself, I'm very interested in nutrition, in mental health care, using homeopathy, using herbs, nutrition, using specific medicines, like counseling and spirituality.
Before I let you go forward, explain to people, a lot of people may not know what homeopathy is, for instance. I know it's not an easy one to explain.
No, that's not. Homeopathy is a medicine in itself. A number of different medical professions use homeopathy. An MD can learn and use homeopathy, vets learn and use homeopathy, and that's a big part of our medical training is learning homeopathy. And it's an energetic type medicine, using very minute doses of certain medicines in order to stimulate the vital force of the person to rebalance. When there's a disease going on, there is some kind of imbalance going on. So it's really a medicine that supports the body to heal itself. It's a push in the right direction is what I like to think it as.
Okay.
And to learn it, it's complicated because there's thousands of remedies. There's a couple hundred common remedies, but a lot of small remedies. So it takes a lot to learn it. It's a fascinating medicine.
Okay, thanks. Continue what you were saying before.
And let me say one other thing about homeopathy. It's very safe. It's non-toxic. Babies, infants, pregnant women, elderly can all use homeopathic medicine. So it's a very wonderful tool to have in my tool bag because it is so versatile. Then the principles of naturopathic medicine, that's where it really differs from the AMA type world. We believe very strongly in the healing power of nature, and that it's our job to support the body to heal itself. That we have a driving force that our body has to live and thrive and to be healthy. We also attempt to treat the cause, not just the symptoms, and that's easier said than done. There's often layers and layers of causes, but we do try and spend the time to tease out the different layers and get down to some of the root causes. Do no harm, that's another guiding principle we have. Using the least invasive medicines, the most gentle medicines first. And children respond beautifully to naturopathic medicine. A lot of times they just need a little bit of help, not a big pharmaceutical, although they're nice to have when something does get scary. Another guiding principle is doctor as teacher, and I take this very seriously. I do a lot of education. Public education, and also of my patients. Treating the whole person, the body, the mind, the intellect, the emotions, and the spirit and soul of the person, and trying to see them as an integral part of a community and a family system, not just a person with a disease that walks in the office. And then prevention is a huge part of naturopathic medicine. You know, the best cure for the common cold is to be healthy, to go into it with. Then you're going to get through it faster and come out of it stronger.
All right. I'm very fascinated by the identify the underlying causes where it seems when you go to an allopathic medicine, in my experience, we've typically, here are these drugs to suppress the symptoms and then wait for the body to hopefully recover. And that seems to be one of the real primary philosophic differences between allopathic and naturopathic physicians.
It makes it also really challenging to be a naturopathic medical patient because it's a lot more work. And my patients, I'm very honored to be able to work with the people that come into my office because they are unusual. In a regular office, they're considered a pain because they ask so many questions. So a patient that's going to be a hassle to an MD is going to be a wonderful patient for me because they want to learn, they want to be a part. And that's what it takes to make this medicine really work in your life, is to own it and work it.
I noticed too that there's a lot of you try to encourage self-responsibility as opposed to the obvious other side, because when you're only seeing someone so often in a short period of time, it creates a dependency, where here you are trying to encourage self-reliance and self-responsibility.
Exactly, yes.
Okay, tell us more about the treating the whole person. I think that's a fascinating aspect of it: physical, mental, emotional, genetic, environmental. That's phenomenal.
Yeah, and that's a challenge. I realized several years ago that what I was trying to do was be a naturopathic general practitioner and then all the specialty fields. A mental health counselor, a naturopathic psychiatrist, a naturopathic cardiologist, a naturopathic endocrinologist. So it takes a while to get to know somebody on all those different levels. But the advantage is you can see interconnections. And one medicine might be able to address several different areas. Where an MD focuses on one problem and treats that one problem, and often unbalances some other area of somebody's health and then creates another problem in the meanwhile. So it's a real advantage to be able to get to know somebody and how they, the type of relationships and the type of things that are getting in the way of them healing and the types of things they're doing in their life that are making them sick.
Okay, and also speaking of making them sick, some of the, as we read the newspapers today, one of the fastest growing new diseases is the disease of being in the hospital, or being in the hospital and catching a disease, or the reactions to pharmacological agents or drugs, or surgery, radiation, etc., like that. And you often see a lot of these people after they've been through that process, haven't you?
Yeah, the typical patient I get is either somebody that's already used natural medicines and wants to continue, doesn't want to use the heavy-duty pharmaceuticals or wants to avoid surgery. So somebody who's already on a natural healing path, or we also get people that are very strictly religious and because of their religious beliefs don't use drugs or don't choose surgery. And then we get the people that have been kind of given up on by the MD world. There's nothing else to be done, and sorry, there's nothing else we know of. And they often, that's a difficult situation to work with if somebody has already been so debilitated by their own disease and then weakened further by some of the medical treatments that we're attempting to try and heal the condition. So that's, I have my work cut out for me in a situation like that.
What are the types of things when someone comes to you in the initial intake? What's it like in your first visit with a typical patient?
I have a very extensive health history form that I have people fill out. It's 7 pages long, and it's mostly fill in, the blank and short answer. But it really gets people thinking about all the different areas in their life, and even though it's like, well, gosh, I have diabetes. Why do I have to tell her about, my health history, my family health history, or what's going on with my digestion? But it's important for me to know about all these different areas. So a typical initial consultation is really me getting to know them and establishing a therapeutic relationship, because I'm really a health coach, so I need to have somebody trust me and like me well enough to want to work with me.
Yeah. Carry on. You have something else you were going to share with us there.
This was, I want to show the viewing audience a chart contrasting conventional MD, model medicine, and naturopathic medicine. This gives you a good idea of the differences. And this was developed by one of my teachers during my naturopathic medical school in Portland, Oregon, Dr. Jared Zeff. And he did a wonderful job condensing this. So you'll be able to see this as I read along. The conventional MD model of medicine is really focused on diagnosing, naming the condition, and then the treatment of that condition. So the DX is diagnosis, TX is treatment, and DZ is disease, the diagnosis and treatment of disease. And the assumption there is a disease name, that something that this discrete disease can be conceptualized as an entity separate from the body of the person suffering their effects. And these discrete disease entities are nameable, are identifiable, and that these disease entities can be treated and be eliminated from the person. In this model, the function of the doctor is to diagnose, is to identify the disease, the cause of the patient's suffering, and to remove it from the patient. And sometimes this model works really well, like in an infection or in a grossly malfunctioning body part, like a thyroid that's got cancer and just is not working anymore. So the methods that the MD model uses is an incredible array of pharmacology agents or pharmaceutical drugs, surgery, radiation, and there's a few other options, but that's basically it. And these methods work primarily to impose an external order on the biological system by using biochemistry to control a situation or surgery to remove a part. So that's basically the MD model. And I'm going to change this to the naturopathic model. The naturopathic model, our focus is the restoration of health. So we start off at normal health, and normal may not be very well, but whatever that person's normal is. And our body has a driving force, a vital force, trying to get to optimal health. So in a disease, in a situation, there's some kind of disturbance to normal health that causes an irritation. And the irritation may be, or the disturbance might be a fight with your loved one, or an infection, or falling off your bicycle, or developing some kind of heart condition. So the disturbance causes an irritation. The irritation, if it's not resolved immediately by the normal homeostasis of the body, can go into inflammation, and that calls in the immune response, where you get redness, swelling, pain, and I'm forgetting one. Swelling, pain, redness. That's a normal inflammation response. And when you heal an inflammation, when it becomes a physical reaction, you always get some kind of discharge in order to get back to normal health. And the discharge can be a runny nose, a cough, vomiting, diarrhea, or yelling, or crying, or some kind of emotional or physical discharge. And if the body is not able to heal that inflammation, it can go into a chronic inflammation. And the chronic inflammation can be reversed and healed. If chronic inflammation continues and is not resolved, it can go into physical tissue degeneration, where the degeneration can become an ulcer, can become a tumor and become cancerous or malignant, or can cause scar tissue that limits the movement of the person, or can cause atrophy, so a gland or a muscle just doesn't work, low functioning or at all. And as you can see from this chart, there are certain processes that are reversible, but when you get down into, when you get degeneration and ulceration, tumor, scar tissue, and atrophy, those are not reversible. So what we're trying to do is catch this process while it's still reversible and help the body heal.
Let me just ask you a question at this point, because I know in my own case, if sometimes when I've gotten sick, part of it had to do with bad diet over a period of time, and I had to go through a cleanse, and cleansing out the natural healing process to do that. In this chart, that's considered part of the discharge, or where would that be, just out of curiosity?
Poor diet can cause inflammation, can cause chronic inflammation, and then can cause degeneration.
Okay.
The healing process that you're talking about with a cleanse, that goes into the methods of addressing a problem area. So the problems, or the methods that a naturopathic physician uses to address some of these problems are first to identify, to name if possible, or to recognize what systems are being affected, and to try and figure out what are the underlying causes and address those causes. And we do that by counseling, a real in-depth history, diet, evaluating digestion, evaluating the stress level in somebody's life. And then we use different types of healing modalities in order to stimulate that vital force, the self-healing potential of the person. We use hydrotherapy, which is using hot and cold. We use homeopathy, acupuncture. Some of us are trained in acupuncture, I'm not. Botanical medicine or herbs. specific nutrition, vitamins, minerals, tissue extracts. Those are like adrenal glandulars, different animal medicines that help nourish a certain tissue that's not working up to par. And we also use physical medicine, chiropractic style adjustment. The chiropractors have that term, adjustment, in their profession, so we use manipulation to describe what we do, moving joints. Exercise, and we also use physiotherapy, which is using ultrasound, using deep heat, using diathermy, different ways of helping the body heal.
Would any of these include like massage or body, or would that be considered?
Yeah,
part
massage would be under the
Oh.
structural integration, the physical medicine.
Okay.
Yeah.
Yeah, that's quite a bit to take in. We've only got a couple of minutes left.
Okay.
Just in the few minutes we have left, what else would you like to share to people out there if they've had any kind of doubts about it, or what would they expect when they came to see you on a professional basis? Besides what you've already mentioned, just
individualized care. I mean, that's one of the hallmarks of going to a naturopathic physician, is we're medically trained. We're a good bridge between what you can do at home and avoiding hospital care. We're wonderful at working with individuals and tailoring a program specifically for your condition, treating you as a unique, beautiful individual. If you're interested in knowing more about naturopathic medicine, I'm going to be hosting a show on community TV called New Mexico's Naturopathic Medical Show that will be airing this coming spring. And I'll be interviewing local naturopathic physicians, naturopathic doctors, different alternative medical professionals. So if you're interested in learning more, tune in and get some more information.
That's great. And also watch the credits and go to Dr. Wendy's website. There'll be a lot more information there. Also, she's been an author. She's written numerous columns for different newspapers in the area, and she practices in Santa Fe and Los Alamos and teaches wherever they want her to come. I think she does. So it's been great to have you here, Wendy, with a lot of great information. I hope this has been of some value to you folks at home. And I encourage you to give her a call, or at least go to the website, which I believe is www.drwendy.info.
Yes.
Okay.
Yes.
Check that out for yourself, and give her a call, and just to see if there's something that could be helpful for you and your family members and others that just don't know anything about it. So thank you for coming. Any final words?
Well, thank you very much for inviting me on the show, Bill.
Okay.
I look forward to interviewing you on my show.
That'll be a joy. Okay, thank you. I want to thank our director, Marshall, and our crew, our Florida director, Alan, and our camera people, Connie and Harvey, and other people behind the scenes, George and others. And well, thank you for viewing, and stay tuned next week at this time for another program on spirituality.